Okay, so let me show you this thing. It's really important, and it's going to surprise you a little bit. As you know, people have throughout history taken advantage of Social Security recipients. We think of them as kind of like the fragile class of Americans, disabled, retired, spouses that are widows, and things like that. The bottom line is, unfortunately, in our system, the way it works, people take advantage of them. Now, here's the deal. There is this massive development that is breaking news that is going to probably be all over the news channels like Fox and CNN tomorrow or the next day or whenever they actually figure out what's going on. But as you know, I, Attorney Walter Hnot, the most viewed, subscribed to, and clicked on Disability Attorney, will deliver to you right now news that usually gets to you a bit like a couple of days before the big news groups actually get a hold of it. Now, here's the deal. As you know, in Florida, there is a magical place. And the magical place is called The Villages. And The Villages, and I have the little overview here, has over 90,000 residents as of 2025. They're projecting that will actually surpass 100,000 residents, which is kind of amazing because you only have to basically get to 500,000 to pass one of the lowest population states in like the upper northern Midwest. So just what you have to kind of keep in mind with this whole situation is that Florida and the Villages will likely be larger at some point, even in the next 10, 15, 20 years, than some states that have big mountains in them. Let's keep going. So here's the deal. It spans over 32 square miles and is continually expanding. Primarily 55 plus people, designated retirement, older adults. They've got over 50 plus golf courses, over 100 areas, recreational. You got pools, pickleball courts, and fitness trails, all that stuff. The bottom line is it is a haven in Florida for old people, usually with naughty kids. Now, I'm just kidding about the naughty kids thing, but the thing is, old people go to the Villages. Now, why is this relevant? Well, we're just gonna get right to the point. We're not gonna waste any time on this. We're gonna get right to the point. I have been able to obtain a copy of the letter sent from the Villages Health. Villages Health is basically the health group that would go ahead and work with Medicare to do the health care for these elderly people who lived, you guessed it, at the Villages. Let's read it real quick. Released July 3rd, 2025. Dear valued patient, because they love you lots. As you may know, in December of 2024, the Villages Health, so December 2024, okay, so the end of December 2024. So the end of Biden before Doge and Elon and Trump officially took office. Or let me just put it another way. The moments before everyone was going to get audited, the moments before big corporations that had swept a lot of dirt under the rug and didn't worry about Biden finding it, the moments before they were worried about that dirt being pulled out from the carpet and flung across the room in front of the news. Here we go. As you may know, in December 2024, the Villages Health self-reported, that's important here, a Medicare billing discrepancy to relevant U.S. government agencies. They self-reported. They called up the government and said, you know what? We may have done some improper calculations. We may have overcharged people. We may have frauded some individuals, right? That's what it is. When you massively overcharge people continuously, repetitively, to the tune of millions, that's fraud, right? So in that instance, right, they're saying we self-reported to the federal government because we made a whoopsie many times over and over and over again. Let me read it to you again. As you may know, in December of 2024, the Villages Health self-reported a Medicare billing discrepancy to relevant U.S. government agencies. So in other words, instead of saying the government figured it out, the government found them, they got ahead of Trump. They got ahead of Elon and said, you know what, guys, we know audits are coming, and we are going to self-report that we made a big whoopsie to the tune right now, so far as it is, of over $360 million of overcharges. Now, you might be thinking $360 is a lot, but in reality, it's actually a lot. That's a lot of money. Let's keep reading. At the time, and as part of our commitment to transparency, oh, you can feel the corporate jingle, TVH, all right, Villages Health, also communicated this news to its entire patient population. Since then, TVH has been working diligently with Medicare programs toward a resolution with the U.S. government estimated at hundreds of millions of dollars in overpayments and likely significant accompanying penalties. Let me read that to you again. And this is important. This may actually affect you, okay? TVH has been working diligently. They're trying. They're doing real good. Here we go. With Medicare program, Medicare, toward a resolution. Please, government, don't take all our money. With the U.S. government, big scary federal thing, okay? Lots of hair, a little bit of spikes, okay? Estimated at hundreds of millions of dollars in overpayments. Overpayments by Medicare, overpayments by Medicare Advantage, other supplemental health insurance options, the 20% that the actual people, the people who are disabled, retired, elderly, had to pay, okay? Estimated at hundreds of millions of dollars in overpayments and likely significant accompanying penalties. Will risks be slapped? You betcha. Now, here's the thing. If you have potentially been a part of the Village's health system, I was setting up a special email and I was having an issue with the IMAP server, so we're just going to use the regular email at the law firm. Info, I-N-F-O, at disabilityresolution.com. Info at disabilityresolution.com. Let me know. Reach out to me, okay? I'm going to go ahead and try and help you out with basically people that will try to get you rolling in the right direction if you were affected by this situation, okay? And the whole thing that I just want you to understand is that this is big. It's so big that the Village's health, and we have it from the new articles that are just coming out, did something kind of sneaky, but also kind of like, we would expect them to do that. You know what I mean? Just to me, it felt like, here we go. All right, so I'll read to it, and then you guys know what it is. Here we go. Separately and independent from the ongoing conversation with the U.S. government, TVH has been in discussions with multiple parties for the past year and a half about potential transactions and acquisitions. Let me read it to you again. Separately and independent from the ongoing conversations with the U.S. government. So aside from TVH basically self-reporting about overpayment fraud that they committed against a lot of people that live in the villages or around the villages, the Village's Health has been in discussions with multiple parties, so other peeps, over the past year and a half, year and a half, potential transactions or acquisitions. Now, transactions traditionally means basically what transactions, what money was made, how things were paid, stuff like that. That's not the important word. The important word there is acquisitions. Acquisitions means they're trying to find somebody to buy them, to bail them out. That's what that means. When they say potential transactions or acquisitions, acquisition, they're trying to get basically some other mega company to buy them out. Today, TVH filed for Chapter 11 bankruptcy. What a surprise. Which is a portion of the U.S. Bankruptcy Code that allows for corporate restructuring. Okay, so let's go through this real quick. There's different versions of bankruptcy. You got Chapter 11 and then many others as well. One of them is kind of like, hey, we're just going to try and restructure and figure this thing out and kind of go from there. And then another one is like, it's dead. There's no hope. It's over. Gone. We're rolling up the books, rolling up the carpet. We're throwing them in, this little bin over here, and then it is what it is. Okay. Today, TVH, this is July 3rd, filed for Chapter 11 bankruptcy, which is the portion of the U.S. Bankruptcy Code that allows for corporate restructuring. Why are they doing this? Because they know the penalties and the lawsuits that are coming from those on Medicare who are disabled, who are retired, who are elderly, are going to likely be more than the TVH is actually worth or capable of paying back. So it's an extremely spicy situation. TVH is also signing an agreement to sell its assets to Centerwell, a healthcare services business of Humana. So put another way, they're selling all their stuff to Humana because Humana has the money to take the financial hit and still survive this cluster bleep. Okay. This will allow the healthcare system, which has been providing amazing care to our patients for all these years, to continue on in the hands of a national healthcare service organization that has the resources and expertise to grow TVH and to enhance patient care. They're just leaving at the end of that sentence. The one thing that's important is to allow TVH to survive under a new corporate owner because they don't have enough money to survive the pending upcoming penalties and paybacks and settlements that they're going to get hit with. I first want to reassure you that TVH is not going away. Okay, so this is the end of the letter. I first want to assure you that TVH is not going away. Sure, they've sold its assets. Sure, it's going to be labeled a new name, because they're not going to keep something that's going to be in the news and sued and all that stuff over and over again. Humana is now taking it over. They're using essentially CenterWell as part of it. It's not going away. It's just not going to be anything of what it was because now it's going to be just a different company owning them, right? So different procedures, different regulations, different, this is how it works. The buildings will still be the same. A lot of the doctors will be the same, but it's now going to be owned by some other corporate entity. All right, let's keep reading. I first want to reassure you that TVH is not going away. The doctors and their staff that created this overpayment nightmare and, potentially, well, they didn't potentially, they self-reported it, committed basically overpayment fraudulent transactions, okay? So TVH is not going away. We are still the same doctors who overcharged people. Some didn't. Clinicians who overcharged people. Some didn't. And care teams who overcharged people. Some didn't, though. Okay. Caring for our patients. There you go. There you go, buddy. There you go. I also want to emphasize that TVH patients are expected to have continued access to their current insurance provider, regardless of their selected insurance plan, due to CenterWell's payer-agnostic structure. So yay, you are going to be able to transition right to CenterWell, which is basically owned by, Humana, and the bottom line is that life will continue. You just want to make sure that you're actually paying the proper amount now because you weren't potentially before. That's just one of those like little wrinkles in this muddy situation that just needs to be ironed out with, a pressure washer, just a little bit of make it nice. That's all I'm saying. Okay, here we go. We will do everything we can to make this transition as seamless as possible for our patients. So just to be clear, the company self-reported because Trump was coming into office and they knew audits were coming, right? They knew it. They didn't know if they're going to get hit, but they knew that they had a big problem. And it was so bad that it was hundreds of millions of dollars, now totaling over what they're reporting $360 million plus. Okay, cool. So we now know from this situation, right, that they will do everything that they can to make this transition as seamless as possible to our patients. The only problem is with this entire situation is that, unfortunately, they are not somebody to be really trusted going forward. Because for them to hit $360 plus million in potential overpayments that they self-reported out of fear of future audits, you have to understand that is organized crime level, continuous, repetitive overpayment scenario. And that's a scary thing for a lot of people because at the end of the day, who are they going to trust, right? They want to trust their lawyers, their accountants, their doctors, their surgeons, especially their surgeons. They want to trust those people. All right, that's the letter that they released. Very cute, loved it. It was a great story. Now let's go over to what Bloomberg had to say. A healthcare system serving the largest retirement community in the U.S. has filed for bankruptcy after disclosing it potentially overbilled Medicare by at least $350 million, according to court filings. Okay, I'm going to do another video specifically where I pull up the court filings, so long as they are not restricted access to the public. The Villages Health System, LLC, which operates clinics for retirees living in the Villages in Central Florida, said in a July 3rd court filing that it logged patient diagnoses that were not clinically supported or otherwise did not meet Medicare coding and payment guidance. TVH said it discovered the problem in August, disclosed it to the Department of Health and Human Services in December, and sent a written notice to its patients. The healthcare system filed Chapter 11 last week, which is them trying to run away from the situation, trying to get rid of liability, trying to sell off the good books, the bad books, and trying to duck as much as they can with this situation. The bankruptcy comes weeks after the Trump administration announced plans to expand audits of Medicare Advantage plans, the types of coverage used by most of TVH's 55,000 patients. Once again, let me read that to you again. The bankruptcy comes, them ducking out, weeks after the Trump administration announced plans to expand audits of Medicare Advantage plans, the type of coverage used by the most of the TVH's 55,000 patients. Like I said, Trump was coming in. They knew they were doing something wrong, so they self-reported because they were afraid of what was going to be coming, because that would be epic. The criminal lawsuits against the Village's health group as a result of this. Now, with that said, I am buddied up with a group. Okay, they basically are sponsoring videos. Let me give it to you real quick. If you're worried about your plan, where basically you're not sure if you've got a plan that's going to be affected by this situation, Chapter right here. Chapter is aware of it. They're aware of the situation. They're aware of what's going on with it. If you want to check in with them, give them a call. Okay, calls are free, super simple. You got 15, 20, 30 minutes, sometimes less. Give them a call. Let them do a tune-up on your Medicare program. Okay, I'm not saying that everything's going to be perfect and wonderful and magical and unicorns, but give them a shot. Just give them a call and let them go ahead and do a tune-up on that Medicare Advantage options or whatever that you potentially should need for your medications, surgeries, impairments, diagnoses, whatever. And the point is, these guys are following this situation, so you should talk to them about the situation. Say, hey, am I working with doctors that are problematic? Am I working with doctors who are unfortunately submitting things through this payment system in an improper way? Either way, 339-226-6287 or askchapter.org/disability. That's my special little link because I'm the most viewed, subscribed to, and clicked on disability attorney. Let's get right to it, people. Here's the deal. So TVH said that it discovered the problem in August, disclosed it to the Department of Health and Human Services in December, and sent a written notice to its patients. The healthcare system filed Chapter 11 last week. Now, think about the timing of this. They realized it in August, okay, before the elections. They then self-reported to HHS in December with a written notice to its patients. They were very worried about a non-Biden situation going forward, because Biden would let things kind of slide through. I'm not making an immigration joke. I didn't make an immigration joke there. I would never do that. Let's get into this real quick. Okay, so more than half of all people on Medicare get benefits from private Medicare Advantage plans, which are operated by private insurers. Bloomberg reported a complicated system of diagnosis codes determine payments to the insurance companies in Medicare Advantage. Those plans are paid a monthly premium that is adjusted for how sick their members are. So if you can imagine, there's a giant computer code program. And when they do some sort of treatment or they have to go ahead and charge something, they go to the code book, they pick out what the treatment was, they pull the code and they submit it to Medicare and say, we did this. And then Medicare pays them, right? That's the whole schmutz. I mean, there's little steps in between all that, but that's how this whole thing works. TVH was formed in 2012 in collaboration with the University of South Florida and operates 10 primary and specialty care clinics, according to court documents. The broader Villages area spans 57 square miles and houses more than 150,000 residents. According to its website last year, Kamala Harris's husband, Doug Emhoff, made a stop to the retirement community where Republicans outnumbered Democrats 3-1 as part of Harris's presidential campaign. Yeah, I mean, just to be fair, if you're going to a giant retirement community in Florida, it is likely, and I'm not going all political with this, but it is likely that you're going to have more Republicans there than Democrats. It's just very likely. Okay. And to be fair, Republicans, when they move to the Villages, they're looking for a deal. Same thing as Democrats. They're looking for a deal. They want to do a bunch of stuff. They don't want to pay a lot, and they want everything taken care of. They want the lawn taken care of. They want the house, pressure washed, the roof repaired, whatever. They want it taken care of. They want easy peasy. Here we go. Here's where we're moving. Now, Humana Inc.'s Centerwell Senior Primary Care Unit has agreed to acquire TVH, a deal that must be approved by a bankruptcy judge and is subject to better offers in Chapter 11. TVH said the bankruptcy filing and proposed sale to Centerwell won't interrupt its operations. So the doctors will continue to treat people at the Villages. Unsupported claims, a complicated system of diagnosis codes determine payments to the insurance companies. Like I said, there's a big list of insurance codes. whatever they service was, right, or whatever that they're doing, they pull that code, they send it off to Medicare, and they say, Medicare, pay us. This is what we did. How health plans record and submit diagnosis and maximize their payments under the program has drawn rising attention in Washington. Now, you'll know, just as a side note, Trump had his already massive win when it comes to Medicare because it was $14.6 billion, $14.6 billion of fraud that was going on with Medicare that he already got. So like, if you're sitting back and you're like, did Trump get his, chicken winner dinner? Like, yeah, he got that. He got his $14.6 billion in Medicare fraud, which spanned into the time, of course, when Biden was in. So the point is, when a lot of people are making fun of him for, Social Security and he didn't get the coding right, and whereas there are 300-year-old that was getting benefits, no, they actually weren't. He did end up getting his win when it came to 14.6 billion in Medicare fraud. Now, this is going to add on to that and may push it, or actually, it's extremely likely to push it into basically a $15 billion in fraud scenario. We don't know the exact numbers yet. They're still working on it. It is all very, very new still. Also, Telfer M. Preston, thank you for giving out 5 Social Security Disability Benefit video memberships. That's absolutely amazing. They were given to Fawn G. Furry, howdy Furry. All Motor, Princess Diana is actually, she's got like the super ultra. And Doom Pigeon, good to see you, always a cool name. And Kiza, very, very awesome. Very, very awesome. So here's basically the deal, okay? The TVH Chief Restructuring Officer, Neil Luria, said in a July 3rd court filing that last year the company hired outside law firms and FTI Consulting Inc. to evaluate the accuracy of the healthcare provider's coding and to investigate any potential overpayments related to Medicare. Once again, also, if you're in a situation where you might have been a part of that, the Village's, healthcare problem, shoot me an email. I'm going to try and get you off to basically the right people that can go ahead and help you with this situation. It's very sad. It's absolutely horrible that this is happening to the elderly. Bottom line is just shoot me an email, info@disabilityresolution.com. Again, info@disabilityresolution.com. Shoot it over to the law firm, Disability Resolution, and I'll go ahead and from there forward it to those people who can go ahead and help you. Okay. Now, with that said, that investigation identified codes TVH, the Village's Health, submitted that did not appear to be supported by a sufficiently documented clinical basis. Very spicy situation, okay? Now, the inquiry also identified amendments to patient medical records appear to have been inconsistent with the Centers for Medicare and Medicaid Services guidance and based on a misunderstanding of the relevant guidance on medical record amendments, including when it is appropriate to amend a patient's record more than 90 days after an encounter, he said. So it looks like there's some frothing up of potential fraud in different aspects of how things were done with the Village's Health. And that is it's just a spicy, salty French fry to have to swallow because, we expect, especially, there's a lot to it, right? So it's a doctor. We expect them to be good, working with an elderly person. We want them, we respect our elders, take care of our elders, right? Getting money from the federal government, right? That come from taxes that the middle class can't even afford anymore. It's just the whole arcing thing is just not good. It's a no bueno, class 5, not good. A preliminary analysis indicated TVH's potential overpayments could be at or above $300 million, Luria said. Right now, it's just above 360. TVH said it has since brought in independent managers to improve its compliance program and enhance training on sound medical documentation practices and Medicare coding guidance. TVH said it's also implementing an anonymous compliance hotline. Good. You're about $360 million late, but that is good. That I'm very glad to hear that now everybody's on the same boat. I'm so happy with that. The healthcare provider has been in contact with the Civil Division of the U.S. Department of Justice and HHS's Office of Inspector General. According to the court documents, when it filed Chapter 11, TVH said it had been working toward a resolution with the U.S. government on the overpayment issue, as well as likely significant accompanying penalties. So in other words, they know the end is near. They know the existence of the Village's Health is ending. They know the light is setting on the corporation. The case is the Villages Health System LLC, number 25-05156 in the U.S. Bankruptcy Court for the Middle District of Florida. I'm going to bring that up and basically show you guys what's specifically going on with it. And remember, the injured parties are essentially the government, Medicare, the different insurance groups, maybe some insurance brokers. I don't know. Maybe a little bit of stuff there. And then, of course, those people who paid extra money because, there's the 80 and then they got to pay the 20. The person, the elderly, but they got to pay the 20. The disabled person, they got to pay the 20%. So they're actually a party as well that was injured as a result of this. Now, look, I know America isn't perfect, and I know a lot of people are not happy with Trump, and a lot of people don't like him, or the fact that he's able to go ahead and, line up countries, make them do what he wants to his will, and basically do mass audits of the government, which has never happened at this level, to find billions of dollars in fraud. I know a lot of people aren't very happy with him, and then some people absolutely love him, adore him, put them on their Christmas cards, etc. Here's the thing. While this is epic, while this is spicy at the Dorito level that I could not handle on a Friday night without the proper dip, let's go into this real quick. New article, UnitedHealth confirms, it's a new one, UnitedHealth. Now we're not talking about the Villages Health. Now we're talking about UnitedHealth. UnitedHealth confirms federal investigation into its Medicare practices. Oh, it gets so spicy. Here we go. By Tammy Lubby of CNN. What a cool last name. Miss Lubby. Mrs. Lubby. How was your vacation, Lubby? Yes. United Healthcare Group confirmed Thursday that its Medicare program is under investigation by the U.S. Department of Justice and that it is working with the agency. Yeah, it's going to get spicy. And that again, real quick side note. If you guys, think you might in some way and somehow have a Medicare program, an advantage, something, whatever, okay, that might potentially have one of these groups that did a bad thing, give these guys a call. I partnered with them, just it's free call. They'll literally go, they have the largest system. They can see the most potential plans out of any other Medicare group. Give them a call. Just give them a call, let them do their thing and figure out essentially what's going to be a great plan for your impairments, medications, et cetera, et cetera. You know what I mean? I think it was like something around like the average person saves like $1,100 a year. So point is, if you feel like you might be in this situation with these groups, give them a call. They're aware of it. They're watching it. They don't want to have a problem with what they're dealing with and what they're basically presenting. So check in with them. All right, let's read through this real quick. Quote, the company has now begun complying, that's UnitedHealth, with formal criminal and civil requests from the department. It said the company has full confidence in its practices and is committed to working cooperatively with the department through this process. That is what I like to call beautiful corporate two-step woohoo. What they're doing is they're saying, yes, we are working with these departments. Yes, they have civil requests. And yes, they also might have some criminal law requests. Look, they don't write in complying with formal criminal and civil requests. They write that in because they know they got to put criminal and civil in there because they know some of the things that are being investigated for at UnitedHealth are potentially rising to the level of a crime against health insured people. Like, just imagine how bad that is. That is just shocking how that could actually be in a situation where we've allowed this to go on to this level. The Justice Department is investigating UnitedHealth for potential criminal fraud. In its Medicare Advantage program, the Wall Street Journal reported in May, though it said the exact nature of the potential criminal allegations is unclear, the company is one of a number of insurers that the federal government contracts with to provide Medicare coverage to senior citizens and other enrollees. Both the Wall Street Journal and the Stat News have published stories that call into question UnitedHealth's Medicare billing practices and noted other government probes into the company. Now, just to be clear, if Trump is able to successfully clean up Medicare, abuse of Medicare, stuff like that, you might actually see a reduction in FICA taxes. You might actually see a reduction in, cost to have your insurance, the yearly cost, Schedule A, Schedule B, all that stuff. You might actually see a reduction because they cleaned it up and got rid of billions of dollars worth of fraud. Let's go into it. In May, UnitedHealth issued a statement saying that it had not been notified of any investigation by the Justice Department. So May, remember, May, and then we got a couple of months, and then we're at where we're at. Bottom line is this. This is a new investigation. This is just happening now. Okay, so May, UnitedHealth issued a statement saying that it had not been notified of any investigation by the Justice Department and that it stands by the integrity of our Medicare Advantage program. It called the Wall Street Journal story deeply irresponsible. Turns out they were being investigated. Turns out it was both for civil and criminal actions for criminal potential fraud. UnitedHealth reiterated on Thursday that it had launched third-party reviews of various policies and practices, including the codes it used to evaluate patients' health status, it managed care practices, and its pharmacy services. The investigation is the latest crisis for the nation's top insurer, which is also one of America's biggest corporations. The CEO of its health insurance unit, Brian Thompson, was gunned down on a New York City sidewalk in December, which unleashed a torrent of angry social media posts about care denials by UnitedHealth and other insurers. Andrew Whitty, who basically, it's the former CEO, stepped down abruptly in May, shortly after the company suspended its financial outlook for the year, citing continued higher than expected cost in its Medicare Advantage program. UnitedHealth's former longtime CEO, Stephen Hemsley, has returned to lead the company. UnitedHealth's UNH stock has lost about half its value over the past year, more than $277 billion. It closed down about 5% on Thursday. So just to be clear, this level of potential fraud, this level of potential abuse, it's never happened before. It's all new. We've never seen this be this bad. So, ironically, was Social Security Administration fraud for disability benefits? Epic. Not really. Was Social Security fraud for retirement benefits? Epic. Not really. Was Social Security fraud for Medicare benefits? Epic. Absolutely. It's getting spicier every single day. I mean, we are talking about holy cannoli, this is a wowzer situation. Okay, so bottom line is, I want you to understand, if you're not sure what to do, this company right here, give them a call, ask them, is your plan going to be affected? Ask them, just call them, tell them, I want you to figure out what plans are going to look really good for me financially in the future. Right here, it's a free call. It's a free call. I don't do Medicare stuff. That's not my thing. That's why I partner with them. I'm going to get their attorney to be able to come on the, the YouTube channel and explain more about Medicare in the future. So we'll have some more cool videos that are instructional. They teach about it. It'll be really good. With that said, the next video we're going to be doing is about a high-level government employee who unfortunately frauded the Social Security Administration. Breaking news just released. We're going to do that video next. Attorney Walter Hnot, the most viewed, subscribed to, and clicked on Disability Attorney. Please remember to like. Some of you don't hit the like button. It's right there. It's got the little fun. Give it a like. You just put a little tickle on the like button, okay? Like and subscribe. Also, if you really enjoy the videos, head over to Google, type in Disability Resolution PA. Again, Disability Resolution Law Firm. Check us out there. Throw some stars up if you want. We always appreciate them. With that said, I go live on Mondays and Thursdays. It's Thursday right now. And the bottom line is I go live, and it'll be my third video where I answer questions for free from the online community. You call up, you get 5 to 7 minutes to ask me a question, and I will answer it. I will hang out with you, and we will get you a solution. The next video, though, is spicy. Also, and I didn't get a chance to upload it yet, we're instead of just doing 1-hour consultations, we're now going to be doing 30-minute and 1-hour consultations. If you want to access my brain and rent it for 30 minutes or an hour, mini contract will be below. Okay. And the simple thing is basically 1 hour, it's the $250. And then basically 30 minutes, it's the $150. And remember, the 30-minute ones, those are actually 30 minutes. The hours, I always do an hour and 10, hour and 15 minutes, because everybody always gets ramped up and they have more questions and they want to talk about how to structure and what to do and all that stuff. So I will catch you all at the next video soon. Attorney Walter Hnot, and give me about 10 minutes and we'll rock and roll from there. Attorney Walter Hnot, thank you so much and have a beautiful, wonderful night. And I'll see you at the next video. I'll put it in the chat link with the URL. Thanks so much. Bye-bye, everybody. Bye-bye.